I'm going to mix it up a little bit, give you guys a little bit of exercise, and maybe even be somewhat provocative. And starting with that, I think there's a lot of hype and hysteria around AI. Anybody disagree with that? More hysteria than necessary. So what I'm going to do is prove a point. Raise your hand right now if you or someone you know has bet their life, literally life and death, on an AI system sometime in the past 20 years. Raise your hand. I see 2 people. Okay. Oh, 3 back there. Now, raise your hand if you or someone you know has ever been on this thing called an airplane. Raise your hand. All right, keep it in the air. Don't put your hand down. Keep it up. Are you aware right now of the fact that those 2 pilots in that cockpit are riding on a vehicle that even the 2 engines on a 787, I actually did this homework, have 900 sensors each that are generating data at 120 hertz. Somebody with a calculator figure that out. It's a lot of data. And there's no way any human being, even the best pilot in the world, can pay attention to all that data, right? So we've got this thing called the Autopilot. And the Autopilot's actually watching millions of data sets per minute per hour on those airplanes and actually flying that airplane remarkably well. The pilots are there in case something goes wrong, but for the most part, those planes fly themselves. So the analogy of what we're going to talk about here is in healthcare. Now, let's go back to the plane. Imagine flying on that plane. We just got back from Barcelona last night. 10 hours from Munich to Denver. Imagine they said, let's just check the data once every 4 to 6 hours as we're flying across the Atlantic. Not so good. You wouldn't stand for that, I hope not. But when we look inside the hospital, now in the ICU, we're generating all this data from all those bedside monitors. But you've got kind of a same predicament. Those bedside monitors are generating 1 million pieces of data per hour. And yet, you've got a nurse standing there full time trying to digest 1 million pieces of something. There's no way. And so what happens inevitably, if you've ever worked in the intensive care unit, the patients crash. Crashing is a routine in every intensive care unit. In fact, crashing is a routine on every floor in the hospital. Why do we allow this? It's silly. So what we're going to talk about is changing the entire game of how we monitor patients from here going forward. And once you know what I'm about to show you, you would never tolerate your family member being cared for the way we've been caring for patients for the last 100 years. There's 1 million hospital beds in the United States, 1 million non-ICU hospital beds in the United States, and about 40 million hospital discharges. So this has big implications. We're talking hundreds of billions of dollars. And now we've got an even bigger problem because it's getting more and more expensive to pay a human being to try to watch data that's impossible to keep track of. Patients are in the hospital longer than they need to be. And then once they leave the hospital, they're boomeranging back unnecessarily. Again, a fan of history, this is a slide from 1920 during the Spanish flu of a dedicated nurse walking around room to room once every 6 hours, taking somebody's temperature with a mercury thermometer. So now, in 2025, we have, obviously, the most technology, she's smirking already, technology-based advanced healthcare system in the world. So now, I love these bean bags. Now we have a digital thermometer and a human being that we're paying to walk around once every 6 hours to check a small amount of information. Again, close your eyes and think about that airplane. Just having those pilots have one set of data once every 6 hours as you're flying across the Atlantic. Silly. What we're going to talk about is the combination of medical-grade sensors that can now capture all this rich data continuously off the human body in any setting, both in the hospital and at home and anywhere. So continuous monitoring makes all the sense in the world, just like on that airplane. We want that airplane to get monitored every minute that you're in the air, hopefully every second. But then we want to be able to see what's happening. Now, what this takes is an effortless experience on the part of the patient and the clinician and the family if you're going to send somebody home. So make it really, really simple. Who wants to catch this? You. Good catch. So if you pass that around, that is a, I would say, best-in-class, medical-grade, FDA 510K Class 2 device that's able to measure all those things, or most of those things that we measure in the intensive care unit, but make that possible everywhere, in every bed, hospital-wide, and also when you go home. So it has to be medically, medical grade matters. It has to be real time. We don't want to find out about something a day later or even an hour later. But here's the real keys to the kingdom, which is what you're looking at in that slide is a flawed approach to patient care and patient monitoring. Because again, now we're generating all this rich data from every patient, and then how in the world are you going to pay a human being, see, I love this, to watch this data? We're brought up in medical school and nursing school to watch the numbers. Guess what? The pilots in that cockpit are not watching the numbers. They don't really know what the hydraulic pressure in the landing gear is, or the rotation of the engine number 2's turbine number 3. They don't need to pay attention to that stuff because the AI is watching it for them. So the real keys to the kingdom is the combination of medical-grade sensors in real time, continuously monitoring all this rich data, and then running it up into the cloud. AI it's just the wrong expression. What this is a tool set to help doctors and nurses look like geniuses. That's what we want. We want to make those pilots in the cockpit look like geniuses, right? And that's what the Autopilot system does. And then obviously somebody has to pay for this stuff. So it's only taken about 25 years of my life and gigs at Microsoft and Qualcomm, and over the course of these 25 years, about $2.5 billion that I've had the pleasure of spending on the behalf of other people's money. And here we are. And it's pretty exciting. So we have a medical-grade wearable. Is it making itself around? Hopefully. Okay, good. And those are real. This is live on tens of thousands of patients right now, this very moment. And the outcomes are really, really staggering. And yet, at the same time, it's not all that surprising. We'll talk about it in a minute. So it's measuring a lot of stuff that we've never even measured on patients in the hospital, even monitoring a patient's sleep. Imagine that, a patient getting to sleep at night while they're in the hospital, because now you don't have to wake them up every 4 to 6 hours and say, hey, We just woke you up to tell you everything is fine, go back to sleep. Sleep deprivation is the #1 complaint about hospitalized patients. She's nodding her head, other than the food. So we're measuring all this stuff, and then here we are, moving healthcare from, gosh, I wonder why that guy crashed, to, hey, I think this patient's headed for crashing, and not only that, I now know what to do about it. This is a good thing. And the only way it's possible is to have continuous, high-frequency data and then predictive analytics that say, hey, I've seen this pattern about 100,000 times, and we know what this endpoint's going to be if you, nurse or doctor, don't get in the game and do something about it. So it is a fancy slide, but what's cool is not only can we take all this new rich data streaming off the human body, but we can combine it with their meds and their labs and their ICD-10 codes, and oh my gosh, you're talking about a treasure trove of data that no one has ever had before in the history of human medicine, neither in the hospital and certainly never after somebody goes home. And so what's also cool is it's not about a single moment in time. Again, that's flawed. We take a measurement and we say, oh, it's high, it's low. Well, guess what? If somebody got out of bed to go to the bathroom and their heart rate went above 100 and then they got back into bed, who cares? You don't want the nurses running down the hall, oh, patient with 100 heart rate. It's about the trend. You learn this as an intern, especially a surgical intern at Duke, taking care of 100 fresh post-op hearts. Stable, good. Green. Unstable, bad. And that means windows of time. Stability has to do with longitudinal trending. So what's really important is being able to see a trend far more than a moment or what we call spot measurements. And what this does is it dramatically reduces what's called alarm fatigue. See, when the alarms are always going off, what happens? People start to ignore them. And then you start missing the stuff that's really important, crying wolf. So now you get down to a place where these notifications, man, when that goes off, it's real and somebody better take it seriously quickly. And so here's the dashboard, and if you click on it, it takes you right into the data, and you can see it all happening. But more importantly, this is how it works. Now you have, back to the analogy with commercial flight, an air traffic control system. But now you can call it a care traffic control system, where one human being, and it doesn't even need to be a nurse, this is a technician, is monitoring 400 patients who each have a BioButton and is getting continuously monitored, in this case at Houston Methodist, across 9 hospitals. Every single inpatient has one of these on their chest. And then you have one nurse who supervises 3 techs, so you're talking about one nurse. So when you talk about economies of scale and efficiencies for patient monitoring, think about that. One nurse being able to be responsible for 1,200 patients who are being monitored continuously across 9 hospitals. So we've now done this on over 300,000 patients in the past 24 months, and we have almost 3 billion data sets. What does that do? Well, it allows us to run that into machine learning tools and start to see patterns of everything imaginable. And we can break it down into, well, what happens with heart patients? What happens with cancer patients? What happens with, you name it. And we are now able to apply these predictive analytics. We're reducing nurse labor by 50% because you don't have to pay a nurse to walk around room to room, because this is doing continuous monitoring. We are now able to see early deterioration, an average of 18.3 hours prior to code blue. Imagine that, because right now, nobody sees it coming until you're pushing the code button. 18 hours before the code button, we could say, hey, there's a little pattern here, and that air traffic control system calls the bedside nurse and says, you might want to go take a look at the patient in room 10, because they're definitely starting to head in the wrong direction. And what that does is allows your nursing staff to spend more time on the patients that need attention and less time on those that are perfectly fine. Almost rational. Sorry, I'm not being cynical, am I? What this is also doing is reducing transfers to the ICU by 20%. It's reducing ICU mortality, this was just published, by 20%. Apache scores, if you've ever heard of that, go down. So you're actually catching things sooner, and if they do need to go to the ICU, they're not as sick. And this overall is reducing length of stay in that hospital. Right now, what's been published is 9 hours. We've got now 200,000 of those patients, and it's approaching 12 hours average reduction in length of stay. After they go home, guess what? We're able to keep the same eye on people after they go home. Imagine that. Because as a cardiac surgeon, every time I walked into the room, say, good news, 5 days after I cut your chest open, it's time to go home. And the family goes, whoa, what? You mean we're responsible once we take Dad home? Oh, sure. Here's a list of stuff to watch for, and good luck. Now you're going to send somebody home with this, and we'll be able to keep an eye on them as though they were still in the hospital. So that I think it's cruel what we do to families when we send patients home. So once they go home, we're able to see if they're starting to have a problem long before it's pushing 911 and the ambulance. If there is a problem or a trend, what do? You do a telehealth visit. You send a nurse to the house, or you bring them into the clinic. All of those things are way better than showing up in the emergency room for a $10,000 ER visit or a $25,000 readmission. So I'm giving you a peek into the future, but it's actually not the future. This is all possible right now, today. So raise your hand if you're about to fly home tomorrow, and the pilot gets on the mic and goes, just for fun, I'm going to turn off the autopilot system and give it a whirl. Get off that plane. Okay, so I want to ask you this in all honesty. Knowing about this, raise your hand if you'd feel great about the idea of any of your family members being in the hospital and getting a nurse checking on them once every 6 hours. Anybody? All right. This is the end. 5 years from now, it will be medical malpractice. And it should be, knowing what we know. Thank you so much. Really enjoyed it.
Thank you.